For nearly a century, antibiotics have been the silent backbone of modern medicine. From a simple throat infection to major surgeries, organ transplants, and intensive care, antibiotics make all of this possible. But the uncomfortable truth is this: the effectiveness of antibiotics is slowly eroding. Antibiotic failure does not mean all bacteria suddenly become untreatable overnight. It means routine infections become harder, slower, and sometimes impossible to treat. A urinary tract infection that once needed a single 3-day course now requires intravenous antibiotics. A minor wound may require hospital admission. A newborn infection can become life threatening. The dark truth is, this is already happening. What does antibiotics failing actually mean? Antibiotics do not stop working because they are weak. They stop working because bacteria evolve. Bacteria are living organisms. When exposed to antibiotics repeatedly, especially at incorrect doses or for incomplete durations, the weakest bacteria die, but the strongest ones survive. These survivors carry genetic changes that allow them to resist the drug. Over time, these resistant bacteria multiply and spread. This process is called antimicrobial resistance or AMR. AMR is gradual and cumulative. It shows up clinically as delayed response to treatment, need for intravenous drugs, sometimes complete treatment failure. And this matches what doctors are already seeing in real world practice. Importantly, the resistance does not develop inside one person alone. The resistant bacteria move between people, hospitals, food, water, animals, and the environment. This means even someone who has never misused antibiotics can be affected. Why is this happening so fast today? The acceleration of antibiotic resistance is driven by multiple factors. First, overuse and misuse in humans. Antibiotics are frequently prescribed for viral infections like cold, flu, and many fevers, like conditions where they have zero benefit. As well as people also self-medicate, use leftover antibiotics, and sometimes stops treatment early. And this create ideal conditions for resistance. And second reason is agricultural and animal use. Globally, a large proportion of antibiotics is used not in humans, but in livestock. It is shocking that approximately 60 to 70% global antibiotic use is in animals. The resistant bacteria from animals can enter the human food chain and the environment. And the third one is hospitals as hotspots. ICUs and surgical wards are the major reservoirs. When infection control is uneven, rushed, or poorly implemented, it can unintentionally favor survival of the most resistant organisms. Fourth reason is poor sanitation and wastewater management. Antibiotics enter wastewater in large amounts through human urine and feces. About 30 to 90% of many antibiotics are excreted unchanged. Hospital effluent from pharmaceutical manufacturing discharge. And this is a major issue in parts of India and China. This is not theory, this is a measured reality. Wastewater contains live antibiotic resistant bacteria, antibiotic resistance gene, subtherapeutic antibiotic concentrations. These conditions are perfect for selection pressure. Selection pressure actually means any condition that forces organisms to adapt or die. Are new antibiotics coming to save us? The reality is, new antibiotics are not being developed fast enough. Antibiotics available today is limited and aging. Roughly 40 to 50 antibiotics are in regular clinical use worldwide. New drugs, rare. Resistance speed, faster than innovation. So, are we prepared? Scientifically, we understand the problem. Medically, we have strategies. But socially, we are not fully prepared. Antibiotics are not just medicines, they are pillars of modern healthcare. And according to the WHO Global Antibiotic Resistance Surveillance Report 2025, 1 in 6 bacterial infections globally is already resistant to standard antibiotics. If you like this video, please subscribe to the channel and hit the bell icon for upcoming videos. Thanks for watching.